Seeing my screen now?
Yes, yes. So
Wonderful.
let me just start with, hi everyone, welcome. It's Martha from Our Brain Bank. And today we're joined by Rachael Kittleson from the National Brain Tumor Society. So thank you, Rachael. But before I turn it over to Rachael, I'm going to tell you about the Our Brain Bank app. We have a free smartphone app. And every day you chart your mood, your level of how much exercise you've done, how you're eating, how you're sleeping. And this helps you keep track and mindful of your experience. And it also helps researchers by the data that you provide anonymously is donated for research. So if you want more information on Our Brain Bank, please go to OurBrainBank.org. That's OurBrainBank.org. Thank you very much. And Rachael, I'll let you take over.
Hi, everyone. First, I would just like to thank you all, Our Brain Bank, for allowing me to be here today. My name is Rachael Kittleson, and I am the Director of Community Relations at National Brain Tumor Society. Before I share my screen with you, I thought I would just share a bit about myself so that you know where I come from in terms of being a part of this. My daughter, when she was 14, was diagnosed with GBM back in 2015. And she battled for about 2 years and passed away in 2017. And since then, I have been a part of the brain tumor community and trying to find ways to make a difference, and was lucky enough to be able to be a part of the National Brain Tumor Society team as of this past February. So today, what I'm hoping to do is show you a little bit about what National Brain Tumor Society has in our Connections program and how we are always working to improve the patient experience and also to sort of ensure that the issues and challenges that we as a brain tumor community face are being met. And so I'm hoping that as I show you some of the pieces of our program, and also that we can have some time to sort of interact. You can tell me a bit about your experience, tell me a little bit about what it is in terms of resources that you're looking for, so that I can take that back to our team. We are constantly reevaluating what we do so that we can best meet the needs of our community. So I hope that that makes some sense. I do want to make one other comment before I begin. National Brain Tumor Society was given a donation of medical masks from Karyopharm Therapeutics, and they're free for our community. So if anyone on this call afterwards wants to contact me, I'll make sure that I give Martha that information. And anyone that needs medical masks, Lynn, I know you are on the call, and Lynn actually just got a shipment from me. They're shipped right from my home. And so anyone that needs medical masks on this call, please just contact me and we will be sure to get them to you. So I just wanted to make sure we get them in the right hands. Thank you. So I'm going to share my screen. Okay. All right. And can you see my screen okay?
Yes.
Perfect. So this is our National Brain Tumor Society main page, our landing page. And on the third tab here where it says Patients and Care Partners, that is where you'll find our NBTS Connections program pieces. So as you click on that, you'll see that we have a number of subheadings underneath. And I will start here with the brain tumor experience. And in the brain tumor experience, if you scroll down, National Brain Tumor Society offers resources in every stage of diagnosis, everything from before diagnosis. If you were to click on, for instance, at diagnosis, it would take you to a page where for someone who's newly diagnosed, you can find a glossary, information on different tumor types and treatment options. And you will also see the importance of genetic testing, information here for caregivers, and also questions to ask your doctor. And that's actually an interesting piece. National Brain Tumor Society, actually myself, we are working right now on a key questions educational campaign so that patients, as they are heading in to appointments with their care team, whether it's at diagnosis or during treatment, they have questions that they can put right in their hands to ask their doctor, things they might not think of on their own. And so each one of these stages has questions about your diagnosis that you can kind of pull from. And again, National Brain Tumor Society, we're working on a nice printable form for you just to print out and take with you or have on your handheld device when you go in. And again, as you see here in our brain tumor experience, we have resources for before surgery, after surgery, but before treatment, during treatment, and all the way down survivorship. Our brain tumor experience really tries to cover a lot of information for our community. Moving on down, again, under our patients and care partners, our connections program here, we also have patient assistance resources. And this is a great place. We have headings at the top to find information on financial assistance, guidance and counseling, housing, transportation, legal advice, medicines, prescriptions, insurance assistance, and specialty services. And if you click on any one of these, under financial assistance, we actually provide a host of different websites, different organizations that can provide, in this instance, financial assistance. And it gives you a bit of a description underneath. So instead of having to kind of go out on your own and try and search these things out, we've tried to create, and we're always reassessing the resources that we offer, places for you to go, places for you to be able to check, and they're places that we, support. And again, so there's financial assistance. You could even click down to housing and transportation assistance. And there's a lot of different places for you to go to get the assistance that you may need. Moving on down, we do have quick brain tumor facts, which you can check out on your own, but it does give some brain tumor information, especially if you're ever out talking about brain tumor facts, perhaps with your own legislators. We do give you a place to go to get your latest facts and figures. But one of the other things I'm very proud of, and Lynn has been a part of this program, and I'm always happy to see her, is our brain tumor support conversations. This is, again, a part of our Connections program. And our brain tumor support conversations are offered once a month on a Sunday, 4 p.m. Pacific time, 7 p.m. Eastern time. And it is a place just for our community to come together, whether you are a patient or a caregiver or survivor. This is a place where you can go and just talk. They do have some talking points that they go by, but really and I'm sure Lynn could attest to this, is a place where you can come and ask the group, how are you handling things with COVID-19? And the wealth of information and the wealth of camaraderie among that group is great. I'm on those calls every month, and honestly, they're probably one of my favorite things that I do. After that call, there's always folks that I connect with, and there's folks that connect with one another. These are led by two facilitators. One is Adam Hayden, and he himself is a GBM patient. Who was diagnosed in 2016, and the other is Lisa O'Leary, who her husband actually passed away from GBM. And the two together are really great with our whole group. They provide a really great guidance for the discussion. They come with a wealth of information and experience. And again, it's a great place to go if you're looking to connect, if you're looking to just feel supported, or just to listen and just be a part of things. Again, it's probably one of my more favorite things that I'm a part of. And the other piece that I'll speak to you about is our personalized support and navigation program. This is new. We rolled this out in March, and we are really proud of it. This is a program that we offer to our patients where they can go for some one-on-one questions and support. It is our patient navigator is the one who heads this, and that is Dr. Mary Lovely. She's been a neuro-oncology nurse for over 30 years. She has run support programs for a very long time and comes with a wealth of experience and knowledge. I work directly with Mary, and I can't love her enough. And she is a great person. Folks who contact us, we often put them in touch with her. She gives guidance, never medical advice, but she gives guidance. She directs to different resources, or is just able to answer some questions based on her own experience. But our personalized support and navigation program is something, again, we are very proud of. This is actually a picture of Mary, and it gives her philosophy on what she does. And if ever you want to be in touch with her just to ask some questions or ask about resources, the email for that is patientnavigator@braintumor.org. Very simple. And actually, both her and I get those emails, and then we are able to triage them and get to the answers for whomever has contacted us as quickly as possible. So really, that gives you a pretty good sense of our program. We also have our clinical trial finder, and we're just putting some finishing touches on that. And so I had actually had mentioned with Martha, I'd love to be on another call where I could really kind of more go in depth with that once we have a few things finalized on our end. We pull from clinicaltrials.gov. And so we have a few things to work out with them on their end, and then hopefully we will have that ready to go, and we can talk about that maybe at another time. But with that, that is probably a lot of information and a lot of me talking. I would love to hear from you. Questions on these programs from our Connections program and our toolkit, or just, sharing some information with me, or sharing some insights or questions.
Thank you, Rachel. That was excellent. I only know Adam and Lisa through Twitter, but I know they're incredibly active. And actually, Adam was he was part of our brain bank at the very beginning. He was a big part of getting people involved. He's doing his own thing now, but we fondly remember. Actually, I don't know him personally. Jessica, do you want to talk about Adam for a second?
Yeah, I think that Adam's great. I think that we're, very much similar in what the National Brain Tumor Society does, and indeed what the American Brain Tumor Society does. These are, and the, International Brain Society. These are great organizations. And I think we all need as much support for work that looks at brain tumors as much as possible. Where our brain bank is very much really focused on this one horrible disease, as we know, glioblastoma. And I think our particular spot is just trying to focus on the patient's perspective. But I think that the more organizations and the more ideas, the better. Because as we all know, glioblastoma does not get the funding that we all need, and it doesn't get the understanding that we all need. So the more and more that we can all work together, the more we can have ideas, the more creativity we can engender, I think the best. I was really struck when I remember that my neuro-oncologist, who's this fantastic guy, Fabio Iwamoto from Columbia, and he's the chair of our brain bank's medical board. But I remember really early on when I got glioblastoma, which was just over 4 years ago. I remember him saying to me that he reckoned that only about 4% of the funds that are available from researchers that might be available are. It's really hard to get funding for our disease, let alone the right kind of funding. So all of us need this, because the more we can get to this disease, the more for all complex cancers, particularly brain cancers. We've done lots of work with the National Brain Tumor Society, and we think they're fantastic. And I think they think we're pretty good too. Let's all work together and make this much more of a priority for all of us.
Well said, Jessica. Rachel, I had one more. I couldn't see the whole list of the financial opportunities for people, but there's one more. Are you familiar with the brain? Oh, Tracy, you're on this call. Can you talk about your fund for the COVID-19?
Sure. So I'm with the Brain Tumor Network, and we have a sister foundation, the Sontag Foundation, which provides a lot of our funding. And we have a they have a COVID-19 fund which is for brain tumor patients specifically. So you have to be a brain tumor patient. You do not have to have been diagnosed with COVID. You just have to be somehow affected by it, which all of us are. So let's just be honest, anybody can say yes to that. And so it's a one-time grant in the amount of $500, and there's a number that you call. They ask you a few questions. I've had a few patients that need to send in a driver's license or something very simple like that. It's not a long application at all. It's very easy to obtain. So yes, please share that that's available. There is still funding available for that. I know that I was noticing, Rachel, on the list, like some of those organizations are out of funding right now due to COVID. So it is nice to be able to tap into the COVID funding when the other funds are on, like the Allison Whitney Foundation, they're on hold right now for June, check back in July. So that kind of thing is happening a lot with the regular funding. But then if you're doing a search or you want to look into some other resources to type in the COVID, there is still funding through Cancer Care and through a lot of the organizations that you have on your list have COVID funds. So it's just a good little loophole right now.
It's great feedback. No, it's great feedback. As a matter of fact, we do have that listed. What we have is which I was going to share my screen again, but I didn't want to lose you. We created a COVID-19 resource page for all of our patients. And what we did, we do have the Sontag on there. We made them for COVID specific, if you will, financial resource help. So it's a really good point, though, about maybe also putting it under our regular financial resources. But we do have it listed on our COVID page. But
I didn't mean
no,
to.
but it's a great point. It's a great point to put there too. But yes, I am aware. It's a great it's great offering.
I think the HealthWell Foundation has one. I'm sure it's all on your list, but so yeah, and that is something I think people are sometimes resistant to apply because they're like, oh, somebody has it worse than me, or oh, I know my neighbor lost their job and I didn't. But I really think that it's important for all of us to know that we can apply for these things. And a lot of the COVID funding, there isn't the eligibility requirements that there are for other funds because everybody's having a tough time right now. Mm-hmm. And so I think it's perfectly okay to reach out and get some assistance for anybody right now.
I couldn't agree more. And it's true. I think that sometimes people think that they aren't eligible or they don't want to take it from someone else. And it's just not the case. It's a very good point.
Rachel, could you speak? I know you're still said it's a work in progress, but about the clinical trial finder, because I myself have gone on clinicaltrials.gov, and I think everyone here knows I'm not a GBM patient, but it's just bewildering the amount of options and trying to figure out if you qualify, because you just start reading the description and it's just, they don't write them for the average person. They're really written for doctors and nurses. So it's kind of bizarre. So I think, are you trying to make it give it a more human face and easier?
Yes, honestly, you couldn't hit the nail on the head better. It really is true. Clinicaltrials.gov can be a bit of an overwhelming search engine, wonderful search engine, but a little bit overwhelming. And so our clinical trial finder, we're actually working with TrialScope. And we're just in the process of tweaking a few other things so that when folks come to our clinical trial finder, there's just a few questions. And so what we've tried to do is take what clinicaltrials.gov has and already kind of weed out those things that just would not, fit with what anyone would be searching for. And so when they put in just a few questions, the list that comes up will be a lot more reasonable and more in tune with what the patient who is searching for that clinical trial is actually looking for. So no, we don't necessarily redo a lot of the trial wording. However, what we do try to do with our clinical trial finder is it's going to be able to weed out some of those that just really wouldn't apply to that patient and make that an easier process when they're looking at them. So we're very proud of it. We just, like, as I say, we have a few things to work out with clinicaltrials.gov just to sort of finish and tweak it and make sure that it's searching appropriately. But it's a great tool for those that are looking for clinical trials. And having done that myself with my daughter, I understand it all too well, and how overwhelming it can be. And this will hopefully make it much less overwhelming.
That's great news. Has anyone on here, Kevin, have you tried searching on clinicaltrials.gov? Oh, you're muted. Hold on, let me unmute you. Sorry. Okay.
Yeah, it was a bit overwhelming at first, and then I just talked to my new neuro-oncologist at the James Center in Columbus, and right now, because I don't have an active tumor, I don't qualify for any trials at all right now. So.
Got it.
So I guess that's good and bad, because it's good that you don't have an active tumor, of course, but then you can't get a trial. But that's excellent. So it's interesting. I often hear that people, when they first get diagnosed, they're in such a panic. They just do whatever the doctors say, and they don't know the questions to ask. So I'm really glad to see that, Rachel, the questions to ask your doctor. We actually did a whole one of these chats with one of our medical advisors on exactly that. You know, don't be afraid to ask anything to your doctor. And actually in our group the other day, a new member, Cindy, she had this great quote. She said, "The only stupid question is the one you don't ask." And I thought that is really so simple, but really profound.
It's really, it's such a great point that you make, Martha. And one, in all of our key questions educational campaign, one of the things that we really honed in on was that before surgery question deck, because there are questions that any brain tumor patient, you know, especially GBM patients, should be asking before surgery. And sometimes, to your point, you know, folks are in such a whirl, and they don't know up from down. And so sometimes those questions, you know, they don't even know to ask. And so we really are trying to put that in the hands of patients. And that's part of the campaign, is not just sort of having it on our website, but making sure people see it and know it and can make it accessible when they go to their appointments. I couldn't agree with you more. It's so important.
Could you talk a little bit about the process? You just touched on it in your presentation, but the getting your tumor analyzed and the difference between genetic and genomic. I don't expect you to go into the science of it too carefully.
Good, because I can't.
just when should people do that? How is it done? Because I've seen,
Sure.
I know obviously some doctors offer to do it, which is great, but I know others, I imagine it just doesn't come up and the patient doesn't know to ask. And then I've also seen for-profit companies that are just standalone companies that do that analysis. And is that, and it I don't know how that connects with the regular treatment. So if you know about that, that would be interesting too.
Well, I don't want to speak too far out of turn in what I do know and what I don't know, but one of the things I can say is we did find it to be an important enough question that it is a part of our key questions campaign. And again, I don't want to speak out of turn, but from some personal experience in seeing it and some of the things I saw when putting these questions together, I think that's one of those important questions to ask before surgery. Because again, if in fact a piece of tissue can be used, you know, and designated to be sent out for genetic testing after that surgery is done, I think that that is an important question to be asked before surgery. Not to say that if you've already had surgery, it's still not something to be asked. I definitely think that it is. And in terms of for-profit, et cetera, I don't, unfortunately, myself have a lot of information about that. But honestly, if it's a question that you have, I'd be happy to do a little research and come back to you with it. And at least it'd be something that you can share with your community afterwards.
Are you talking about like Foundation One?
I know there's
that kind of thing.
There's several ones. I've heard of Foundation One.
So
we use Foundation One.
A lot of what, so like some of the larger cancer centers that have neuro-oncology programs can do their own testing, but some of the ones that don't have their own testing will use organizations like that, if that helps answer your question.
And so how would obviously a patient should ask their doctor as a first
Correct.
step, but are doctors always receptive? There's no reason not to do it, right?
Yeah, I mean, I think honestly, anytime that you are, I mean, that's why it's, you know, part of your question campaign. If you are asking your doctor, I can't imagine any doctor denying that. Sometimes there are, depending on if you are going outside, like a foundation one, there are sometimes insurance issues. So you want to make sure, perhaps at your care team themselves. For us, our care team helped take care of that, but to make sure that insurance will in fact pre-authorize it, if that's, you know, 'cause sometimes that is an issue.
Jessica, did you want to say something? You're muted. I can unmute you.
Yeah, I mean, I think this is one of my personal areas of great frustration, because it's so important when you're diagnosed early on to become informed. And that's exactly the time that's probably most hard for people. And I think if you know of anyone or any friends who can help you become informed as soon as possible, the better, because it's such a difficult time. So, for example, in my own case, I wasn't asked, but I was lucky to receive Foundation 1 analysis of my tumor early on, but many people aren't. And one of the things I think we need to do as a movement is become much more informed of issues such as this, because it's terribly important, and it can make a real difference in your ability to get good care early on. So I couldn't agree with you more. So I just wanted to add that. And I'm sure the National Brain Tumor Society has good information on this, but actually we all could. And one of the things we're trying to do at our Brain Bank is become better informed on all aspects of the experience of people living with GBM, so we can understand how things like Foundation 1 make a difference. I mean, I just was lucky enough to be treated in New York. Nobody asked me, but I was given the opportunity to do Foundation 1 analysis of my tumor. But there are so many people in parts of the country where that's not necessarily the case. So really, I think it's important for us all to become as informed as possible.
Absolutely.
Jessica. Yeah, that's a really good point. And the questions to ask your doctor, I think, Rachel, you may not know this, but we're starting in time for GBM Awareness Day in July. We are going to be announcing our GBM Bill of Rights. And this is a list of rights that everyone should have, such as speedy MRI results, the analysis. And so we'll be releasing that. And I think it probably will go dovetail very nicely, Rachel, with your list of questions to ask your doctor, because they're probably very, very similar. So I'm going to, right after this call, I'm going to read it, and I'll send you our Bill of Rights. It's still being tweaked a little bit, and I think we've realized that it's never going to be set in stone, just like the United States Bill of Rights. Yeah. We have amendments and things evolve.
Correct. I think those are all living documents. I mean, just things that constantly need that sort of, you know, revision, just because and honestly, I'm glad that you mentioned in time for GBM awareness. So, you know, National Brain Tumor Society does have their GBM Awareness Day. This year it's going to be July 22nd. And so there's a lot that's going on around that. We will have events throughout the day on July 22nd that folks can be a part of. We'll have community, you know, getting together and being on calls, etc. So certainly I would encourage anyone to check that out, to be a part of our GBM awareness. We have a lot of information on our website. So certainly there's a save the date, and we would love for anybody to be a part of it. It's something we're very proud of.
And I assume this year there will be no in-person event planned, or is still?
Unfortunately, there is not. No,
but I think that I think your lovely colleagues have already agreed to support this Bill of Rights. So that's great.
Yeah, I agree. Yeah, that's correct.
Yeah. It's so important that we can all collaborate and grow all our movements so that we can get a head of steam up on this issue.
Absolutely. More
Yeah.
power as we all work together.
And can I say I'm so sorry that you lost your.
Oh, thank you.
No, I think it's, you know, we gotta sort this all out.
I couldn't agree with you more. That's why I'm here.
Excellent.
That's why I do what I do.
Well, welcome.
Not just for her, but for everybody. For
Yeah.
everybody.
Yeah, fantastic.
Yeah. Thank you so much for all you're doing for us. That's very sweet of you.
Oh, thank you. It's truly my pleasure. I mean, I feel incredibly fortunate, incredibly fortunate. As a matter of fact, when Martha brought this to us, we, you know, I was very excited that we could do it. It was, I didn't have a lot of time, but very glad to be a part of this and get to meet all of you here at Our Brain Bank for sure.
Yeah, I'll just let you know. I think I sent an email at what, 5 o'clock yesterday afternoon. So.
I think so. Yeah, no, this is great though. And anytime we can kind of collaborate and kind of see what we're doing and hear what you're doing and listen to patients. I mean, that's one of our biggest things, is to listen to our community. You know, unless we are addressing your issues and challenges to make the experience better, you know, and that's the whole reason that we're here.
Yeah.
I had a couple of questions for you, Rachel and Tracy. You talked in the beginning about the medical mask. What type of masks is a medical mask? Just one of those disposable blue ones?
No, it's no, it's a little bit better designed than that. I actually have them in the other room, but but I won't move. But no, they're white. They're not the N95 masks, but they're white, and they kind of cover a little bit more closely to the face, and they're actually directly sent from Karyopharm Therapeutics. So
Now, how could I get a hold of those from my husband?
so
He's the one diagnosed with it.
Yeah, you would you can directly contact me. So either I can give you my email address. I don't know if you'll remember it, but actually if you just, if you just email patientnavigator@braintumor.org. So patient navigator is just one word, at braintumor.org. I get those emails. Just put your address. Yes, there you go, Lynn, thank you.
There it is. I went and got
Lynn
it.
got
Oh, okay. Oh, that'd be great. Yeah.
Yeah, they're wonderful. And
It's a one-time use, so you need a lot because you can't keep using that. I mean, I do use it a couple days in a row if I'm not sweating or something, but.
sure. And Lynn, if you need more, just contact me and I'll send you more.
Yes, please. Can I have some too?
Yes, all you need to do, absolutely. That we want to get them in the right hands. I didn't get your name, the one that was talking with me originally, but if you email me with your address, I will ship them out to you by end of week. Should be end of
Is
week.
that Jessica?
No, Jessica. Yep, you got it.
It's
Arlene.
Her name is
I'll
Arlene.
email you.
Arlene. Yep.
Yes. Now, the other
just
question.
email me.
Send me some more because like my husband and I both are starting to go into the doctor's offices for visits. So that's when we really want to have them.
Yeah, exactly.
When I have you written down, Jessica will make sure you get some too. I just need your address, which you can send me privately.
You have mine,
Okay.
right?
Lynn, I have you all set.
Okay.
Okay,
Perfect.
I just shared the patient navigator at braintumor.org in the chat. So, actually, I just sent it to Lynn by accident only. That's silly. I'll send it to everyone.
I forgot about the chat. I could have done that too, Martha. Thank you.
There we go. Okay, now I sent it to everyone.
Now,
Arlene,
how do
did
you see that after we hang up, though?
Arlene, do we have your email? Because if you send it to me privately in the chat, do you know how to do that?
No. You might have it. I mean, because I think I sent you a message through Messenger.
Oh, on Facebook? Okay.
Yeah.
You're in our Facebook group, right?
Yes, I am.
I'll find you after this, and I'll add your email to. We have a big list of people who are invited to this chat, so I can add you to that too.
Okay. Well, I do get your notification that this is going to be starting.
Oh,
yes.
okay, great. Then I must have your email. Then you're on that list. Okay.
Yeah. If not, then I can send it to you.
Okay.
Now, the other question I had was your support conversation under the brain tumor. Is that something you need to sign up for, or do you get notifications?
Well, if we have your email address, then we do send out a notification. But Arlene, I can make sure that we get that to you. So basically all you do is you just register,
Okay.
which is a real simple thing. You just sort of, say the meetings, and then that way you get the reminder with the link in your email, and then you just join us. It's pretty simple.
Very good.
Yeah, and they're great. Lynn could attest to that. She's been to several, but they're a great way to connect.
But they're for the caregivers also, just not the
Yes.
patient.
Yeah.
Yes, it is.
Okay.
And Adam just has a very good way of explaining things, and yeah, he's really good. And so
Good.
is, but yeah, but Adam has a good outlook on life. And
Very good.
Yeah.
And when Tracy was talking about the COVID-19 funding, that's under your braintumor.org website?
So for what Tracy was talking about with the $500 scholarships or grants through Sontag, yep, if you go to our COVID-19 resource page, we have a financial resource section specifically for COVID there.
Okay.
As we were saying, I'll talk to our website people about maybe also just putting it under our financial resources as well. But yes, that is there.
Perfect.
Great.
Yeah, I'm getting a lot of out-of-pocket expenses lately that I wasn't, prepared for.
Understood, for sure, for sure.
Yeah, absolutely. Good point. That's been incredibly helpful and so needed.
Yes.
Yeah.
I've been on a clinical trial and just, it's in another part of the country. And each time I go, it's like more hundreds of dollars.
Mm. Yeah.
So thank you for that.
And it sounds like you could use the masks. If you're doing that kind of traveling, then you'll probably definitely need those masks.
Yeah. Yeah.
For sure. So we'll make sure that you get some.
Thank you.
I have a question. For those of us on Medicare, I don't know, Arlene, if you're old enough to be on Medicare, but I have found, luckily, that I have had to pay for nothing. I pay nothing for anything. I go to the doctor, I go to the hospital, every single thing is covered by, and my Optune, it's all covered by Medicare. So the out-of-pocket expenses, I understand if you have to travel. I get that. But just regular doctor visits and things, I don't quite understand where the out-of-pocket.
No, we don't have that type of out-of-pocket. What I'm thinking of is I've just had to order a shower chair for him to sit in the shower. That's not covered. I've had to order another walker.
Okay.
That wasn't covered.
None of that's covered by Medicare? Not by your
The
supplement?
first one was.
Okay.
And then somebody had suggested in another group that it's a caregiver call system, and it's a thing that the patient wears around their neck, and then a receiver plugs into your wall. So like if he's back in the bedroom and can't get up out of bed, and I can't hear him because I'm in the other end of the house, he can push this little button. I mean, they're not expensive, but the little things keep adding up.
Right. All right, I get it. Oh, do you have a Medicare supplement or Medicare Advantage plan?
A supplement.
Okay, so that's an interesting. I didn't know those things weren't covered. Okay. Thankfully, I so far haven't needed that stuff. So
yeah.
And we use the cell phone when we went, because we live in an apartment. It's just like a long apartment, but I use the cell phone if I need him and he's in the other room. So. Yeah.
Well, I'm afraid when he's going outside to walk with his walker, and if he falls, he has his phone with him, but he wouldn't be able to communicate with the phone.
Right.
So.
I don't walk without my husband. I mean, I can walk fine, but I still don't feel steady enough to walk without him next to me. So I don't do that. Yeah. Okay, I get it. Thank you for explaining.
Mm-hmm.
So Medicare doesn't cover a shower chair. Most insurances don't cover shower chairs, but they will cover a 3-in-1 commode. So if you're in a pinch, you can take the bucket out of the 3-in-1 commode and use it in the shower.
Oh, that's interesting.
Oh, I didn't know that.
Good to know. Thank you.
Yeah.
Little pieces of information.
Yes.
Well, I
Also,
know,
if you order a wheelchair, you can get a free cushion with it, and you should definitely get the free cushion.
Okay.
but let me bring up something else that since we're talking about finances, and I've brought it up before, maybe not in this forum, but if any of the patients out there have life insurance policies that are still in force, you can get that money or a big part of that money now while you're still alive. And that will certainly take the burden, it could take the burden off of some of these expenses, because we did that. And I mean, we're okay, but I figured, well, why not do it? So we applied. Every life insurance policy, no matter what it is, has that rider. It's called, I forget what it's called, but it has a rider. And if it doesn't have the rider, you can have it put on right away and then claim it. So I got a chunk of money and gave money to my children, and we paid off every single expense we have. So now we have no bills. We have no car expenses, except for gas. We don't have credit card expenses. We don't have anything. And because I had to quit my job, and I was half the income of our family. And so it really helped a lot. And it's totally legal. It's not a loophole or anything. So you can do that. If you don't have a life insurance agent that knows about it, get in touch with me, because my husband's in that business and he will make no money from it. That's not why he's doing it. He's doing it to help people, and he's helping a lot of people. So your doctor has to say that your disease is terminal, and GBM is terminal. No matter what we want to call it, it's considered a terminal disease. And so, yeah.
This is such an important point. I want to, we've said it before, but I think it's worth saying again and again. And it's a while since we made that point in the OurBrainBank group. So maybe, Lynn, I'm going to ask you, maybe if you could make that point in OurBrainBank, because people really need to know, and it can make a very, very significant difference.
Oh, absolutely. It took like this weight off my shoulders, because I had to give up half of our family income, and I knew, and I said to my husband works from home, and he's in the insurance business, he can work from anywhere, but he works a lot. And I said to him, if I agree to do this, because at first I felt like he brought it up right in the beginning, and I thought, oh, well, he's given up on me, that's it, I'm going to die, and so he wants to get the money now. But when we finally decided to do it, it was about 2 years down the line, he said, I said, I will agree to do this if you'll agree to spend more time with me, and we can travel, and we can, until this COVID crap hit.
Yeah.
But, right. So we traveled, we did a lot of great things because we could spend time together, because we didn't have to worry about the money.
Yeah.
So, yeah. And I got a new
refrigerator. It's such an important point.
Yeah. It just takes the load off. It takes a burden off of, and it depends on the policy. You may not get all the money. You might just get a portion of the money, and then the rest of it stays in there till later when you're gone. So now my kids can't expect anything, but they got it now, and I got to see them use it, which was even a pleasure. I got to see what they used it for. So
fantastic.
That's great, Lynn. And I know we had your husband, Larry, was kind enough to do one of these calls a while back, and maybe we should do another one, because I don't think I recorded it, and I should have, because it's really interesting information.
Right.
And also but can you get, obviously this is a question for a professional, but can you even get life insurance if you're already diagnosed with GBM? I don't even know.
Well, the only way that I understand it is you can get one of those, I'm not talking from total knowledge, but one of those things they advertise on TV where they don't ask you any health questions, but it's worth nothing. You pay a lot of money for not barely enough to even bury yourself, get buried. So it's not worth it. So, but I don't know the real answer. But usually not. Once you have I don't think so, but that's just from being married to an insurance agent, being an insurance agent.
Well, one thing I'll add is that a lot of times, even if you don't take it, you can stop paying the premiums for the same reason.
It's okay. I remember what it's called. It's called accelerated benefit. It just came, brain doesn't work 100%. It's called accelerated benefit. Oh, and then you don't pay your premiums either. Forget the part that Bratton said, but once you get the money, you don't pay for it anymore. So that's another expense you don't have. But what you're saying, Bretton, I'm not sure about that. I mean, that could be.
I have one of my policies that stays in force until I'm 67 and I don't have to pay premiums.
Wow.
I guess I might can take some, on that policy.
Yeah.
And for now, if I need the money, I'll do it. But I was able to get a premium waiver. So you
Right.
probably need to look into whatever your
Right. Premium waiver is not a bad idea to look into anyway. I don't know if you can get it, but yeah.
I did on one of my policies.
That's
so,
great. That's great.
Just want to point out, it's good to look into your policy, talk to your agent, and see what options is what you're basically saying.
Now that we're home and stuck in the house kind of thing, it's like a good time to go through all your paperwork. And because my husband's getting all kinds of phone calls from people looking at their life insurance and say, well, not even people that are sick or anything, just saying like, well, what should I do with this? What should I do with that? And so he's gotten a lot of business just from this, and he can do everything from home and through UPS and FedEx. So
yeah. My husband is a trust and estates lawyer, so I never had a will before I got married. But everyone should have, a will, even if you don't have a lot of assets. Everyone should have a will, healthy or with GBM, and everyone should have a health directive, and a very clear one. You should understand what it means, not just. You can get quite into depth, and everyone should have that. And I have one now, even though I'm relatively young and healthy, but it's something that everyone should have.
Well, my husband and I talked about that. The will we have, but it needs to be updated because it's from a long time ago. But we talked about the advance directive, all that stuff. And I think it's still sitting here on the desk because we don't agree on what we want. So, but we don't have to. I have to do. They have to do for me what I want, and he has to do. I have to do for him what he wants. But because we couldn't agree, we just never finished it.
You got to get it. Just got to do it. Just make him different. That's okay.
I know it's wrong, but I know that.
Rachel, getting back to NBTS, I know that you all do such amazing work in terms of for Head to the Hill and lobbying the government. And I was just so impressed at when you had to shift to the virtual one, and just how easy it was, and to write your senators. And it was just like, it was great. It was a great feeling. It was very empowering. So actually I want to talk to you someone else in your office about how we can use that same technology for our GBM Day Bill of Rights, because I want to be able to figure out how we can get our community to really take some action. And that have you seen any results from that? Do you know, has anything new happened, or is it everything's on hold because of COVID, right?
Yeah, I mean, everything is on hold, but at the same time, and we really did get a lot of feedback from the Hill in terms of they really heard the clap of thunder that we created. I mean, we ended up with, I think it was 1,600 advocates, and I think it was over 3,000 pieces of email and what have you that went out. I mean, it was huge, and quite frankly, I think even a little more because we were able to do it remotely. I think that there was a lot of great stuff that came out of that in terms of being able to communicate directly. Lainey Samant would be somebody great to talk to. She's the one who sort of directed all of that. So if you want some feedback from her, I can put the two of you in touch with each other.
That would be great, because I know that not everything on the GBM Bill of Rights has to do with legislation, but there's certainly certain things that we need to figure out an action for each one, a practical action for how this can actually happen. Because our goal, as Jessica will tell you, is we have a license to be ambitious. And we want to improve the standard of care, which hasn't been changed. Well, except maybe, I'm still not clear if Optune is officially in the standard of care now, or it is in the US, I guess, at least, but not everywhere.
I think it is here. Yeah, it definitely is in the United States from what I understand, yeah.
So we want to make, for each right, and we want to make something really tangible that we can ask for, whether it's asking from the hospitals themselves or asking from the government. Each one will be a little different.
Sure.
So we'd love to work with NBTS on that.
Sure, I will put you in touch. I'll let Lainey know that that's something that you're working on. She did a lot of work with that.
Great, thank you. Okay,
Sure.
I think we're coming up on 1 o'clock. Does anyone else have any questions for Rachael?
I just want to say thank you. It was very informative. I've just been with the Brain Tumor Network since December, so I'm still learning too. So love to and collaborate.
Yes, it was nice to meet
great
you.
talk. I think it's a great talk. And, you know, it was a great talk, not just informative, but despite having to cope with Zoom, as we all are now, we can still make meaningful connections. And that's really, in the end, what it's about. So thank you so much. I really enjoyed that talk. It was really interesting. It was good to meet you all. Some I've met, some not before. So I really enjoyed it. Thank you.
Jessica,
It was a real pleasure to be here.
it's really nice to see you back. And
Thank you. It's good to be back.
Yeah, Jessica, it's great to see you back. I'm going in the tube on Thursday. Hopefully I'll have good news for everybody again.
Yeah,
Oh, good luck. Sending you all the best. All the best.
Thank you.
Cheers.
Cheers. Okay. All right. So thank you, everyone. And thank you especially, Rachael. This was really incredibly informative. And this will go up on our YouTube channel. And I'm definitely going to link in our Facebook group about the different resources, especially the financial ones. I didn't realize it's so handy to have them all in one place like that. That's really good.
Great. I'm so glad. This was a real pleasure. Thank you very much for inviting me here today.
Okay. Thank you. Okay. Bye, everybody. See you next Tuesday.
everybody.
Cheers.
Take care now.
Bye.
Bye.